We are going to talk today about pornography addiction.
So, huge issue. It has become sort of the issue of the gay community, meth abuse and how it is connected to different sexually acting out behaviors. So what does meth do? It extends the duration of the high. So already you're getting that dopamine blast. And what happens is meth hits really fast and it levels off very quickly. So many people can do more and more of it to keep that dopamine hit going. It fuels the libido. The irony of it fueling the libido is that you can have sex for hours and hours and hours or look at porn for hours and hours, but never have an orgasm. The use of that drug does now, most people really struggle to have an orgasm. So if I'm a porn addict, I can spend hours and days sometimes in that excitement feeling stage without having an orgasm and have to sort of refuel oneself. Like any drug, cocaine, crack, even marijuana, alcohol, it decreases the inhibitions and increases dissociation. So decreasing the inhibitions is, maybe I can do this. Maybe it's okay. And the dissociation really is, I'm disconnected from what I'm doing. This is not a sexual behavior. It's not about sex. It's about disconnection from my reality. So think of any kind of chemical we use, it allows us on some level to disconnect from our reality. One drink, I feel mellow. Well, now you're in a dissociative state. And then it reduces the ability for rational thought. Otherwise, you wouldn't be masturbating for 22 hours. You wouldn't be going without water, food. You know, people coming down off meth, if anyone's worked with meth addicts, often have picked their faces to the point of scabbing and bleeding because it's both OCD, you can hallucinate, and most meth has some level of acid in it, right? Because that's how it's made. And again, it's the gateway to sexual acting out. Big deal is the pornography can take you to the online cruising, not just online cruising now. You've got those apps, Grindr, Scruff. People are now using Tinder, both gay men and heterosexuals. Anonymous partners and exposure to HIV. Barebacking has become the way to go for many people, particularly with the dawn of Truvada. Do you all know what Truvada is?
Can you say what barebacking is?
Barebacking is, sex without condoms. So, and many people use Truvada now, which is it's called PrEP, which is a prophylactic. And if you take it, it shows that 98%, there's a reduction of 98% in the risk of HIV transmission. So if you're on crystal meth, you're taking Truvada, you can hook up with someone easily, you are completely out of your mind. I can do this, there's not going to be consequence. As Greg said at the beginning, this is all about consequences, right? So how destructive is this behavior? And this is physically, psychologically, and chemically destructive.